Well, I think that last year is first time experiencing an open forum. It really works out much as is described, much more conversational. It's the best part of takeaway from a conference, those hallway conversations that have the real meat of lessons learned and the honesty of learning from your peers, but put into a methodology where you're able to share interactively. And I really, really enjoy that. And it really lends itself to advancing an understanding of both relationships, contexts, and examples to learn from. First and foremost, PHII has done so much for our field and has done so much even just specifically to help Washington State as we've gone on our adventure of developing the informatics roadmap for our agency. PHII has been there sharing with us formative tools and templates and instruments for which we were able to guide us through the process and the creation of that roadmap. And becoming an informatics savvy organization wouldn't have been possible without PHII. So anything I can do to participate when I'm invited to come and work with PHII, I jump at the opportunity. A lot of stories from other jurisdictions and able to share some of our experiences and ask questions from our peers about what we could do to take the next step. For example, we finished our informatics roadmap. We've chartered and developed a governance process for advancing our public health data interoperability concept across the entire enterprise of our health department, not just our disease surveillance programs. And one of our next step is how do we operationalize this? And PHII was just announced here at this meeting a new a tool to use, the critical success factors instrument, to help us assess on a project by project level as we advance this enterprise effort. Are we jumping through those hoops and meeting guidelines and milestones as we move from our informatics roadmap into operation? I definitely think that this is something that should continue. Learning from your peers as you become more informatics savvy, and then turning around and mentoring the people who are following in footsteps, I think is something that public health is really good at. And I really recommend that other states and local health jurisdictions join in this, and I hope that it grows over the years to eventually help cover everyone in exposure to these methodologies and capacities. I really enjoyed participating in the LEAD program. I have both friends new and old in the jurisdictions that came, and I think that it's something that is at the heart of what the public health informatics community is all about, which is helping each other to rise up and be the best that each of us can be.